So after seeing all these beautiful surgeries of DSEC in complicated cases, the most important thing that we gather today, a good donor tissue. But that is the limiting factor. We all do not get good corneal tissues. The availability is less. The burden is so much. So what are the alternative methods? Can we do something? Can we do something to reduce the burden of this corneal donor, or to postpone or prevent the need of corneal transplant? Are there any alternative to EK? So to come with the answers, there are medication, ROC inhibitor. These are all alternative. I'll make it very clear. They are not they are just alternative methods to delay. So medications like ROC inhibitors, DSO, DVEC, I'll show you a video about it, tissue engineering, cultured human corneal endothelial cell injection, and the end game, that is artificial endothelial layer. So Fuchs, we have already discussed a lot. So the main important problem is this production of excessive abnormal ECM, which thickens the DM, and this leads to the apoptosis. So then we were introduced to ROC inhibitors, which was being used in glaucoma patients as well. So we get netrasidil and ripasidil. So now the first one has an additional effect because it decreases the IOP as well by reducing the production of aqueous humor. So in combined cases which have a corneal and glaucoma issue, we can use it, and what is more commonly used by all of us is ripasidil. So now coming to what is the side effects. So there are not very gross side effects of it, but yes, there are some limiting factors like ripasidil. The ones in the red are of ripasidil, the conjunctival hyperemia, blepharitis, frontotasidil, reticular honeycomb. We have seen beautiful publications in IJO. So this decreases once we stop this drop, and cornea verticillata. So now there have been multiple studies regarding the use of these ROC inhibitors, and what we have understood is that they activate the corneal endothelial cell migration. The healthy ones from the periphery migrate towards the center and activate cell proliferation. So now these are the photographs. You can see the hyperemia, which goes away after 15 minutes of that, but the patient is very symptomatic during that time. And this reticular honeycomb pattern, which is very commonly seen, or a cornea verticillata, which can be seen after netrasidil. So now ROC inhibitors, apart from using them on their own, they can be combined with certain surgical procedures like DVEC or DSO. So now what is it? So here's a small video. So here we remove the central 4 millimeter of the desmet. So it's like a desmetorexis. We are removing it. And after that, we can start with the ROC inhibitors. So now again, the aim is to delay this central corneal edema before we are referring to a patient, or the patient is waiting for a EK. So DSO, there is no need of a donor tissue, but it requires a careful patient selection. It is a simple technical procedure, but yes, we have to see the long-term results. So DVEC or DSO, it is not a total alternative, but we can do it to delay and prevent an exact need of EK, very urgent need of EK. Now DVEC, this relies on a healthy peripheral corneal endothelial cells, which are going to migrate toward the center and repopulate, right? And if we complement it with a ROC inhibitor, that can help by regulation of the cell migration, proliferation, and decreasing of this apoptosis. So now we can look at this study where we compared a case of using ROC inhibitor after doing a DSO plus as compared to that without a DSO. So it was seen that if we can complement it with surgical technique, the results are better. There have been multiple studies regarding it, but due to shortage of time, I'll skip it. What else? The future, the Kinoshita group and all have done the cultured human corneal endothelial cells supplemented with ROC inhibitors, leading to clearing of cornea. This is a very beautiful, table which has all the current studies which have been done using ROC inhibitors, DSEC, DVEC, and so to conclude, human tissue is precious, and today we have all learned how to use them beautifully and optimal handling of corneal tissue. So we have to take the best combination of the alternative methods till the game changer comes. Thank you so much. I hope I have done before time.
Yeah, very good.
Thank you, Aditi.
Thank you.